Warwick Medical School is a young medical school. It's very dynamic, ambitious and aspirational. An exciting feature of the school is that there's vibrant interaction and it's obviously very conducive to good productive research. The division works on chronic metabolic diseases, things like obesity, diabetes, cardiovascular disease, and we look at ways of either preventing these conditions or treating them.
We do clinical works to improve the management of people with high blood pressure through, for instance, the reduction of salt intake. We are involved at the global level with the World Health Organization, and we have identified the new risk factors like lack of sleep. We're talking about heart attacks and strokes. They account for 2/3 of deaths in the world. Our research is very much relevant to what is the common epidemic in the Western world.
We have a really strong team, a critical mass of clinicians and of scientists working on finding out how the human body responds to metabolic stress. We do translational research and we make sure that the work that we do on fundamental science at the bench is actually important for the delivery of care for the patients.
It is important that whatever we study in the basic science can be translated to benefit to patients and be tested and proven, and also to be benefit to populations and people like you and me. One example is that we are leading the West Midlands Stroke Research Network, a national initiative to improve the participation of patients into clinical research.
A lot of our research is actually done at UHCW, University Hospitals Coventry and Warwickshire. A large number of the members of the division are actually clinicians. The interaction with the NHS benefits hugely from the new instrumentation and capabilities that we have acquired through investment, both by the university and the NHS itself.
For the type of measurements we do, mass spectrometry is the gold standard technique to use. It's the state of the art. Our research focuses on measuring damage to proteins in body tissues and body fluids and how they relate to the decline of health and also development of disease, particularly in early stages.
What we are trying to do is developing new analytical technology which we can use to predict disease in early stages.
The Human Metabolism Research Unit was made possible through joint investment between the Birmingham Science Cities Research Alliance, the University of Warwick and the NHS. It gives us a fantastic tool to be able to study individuals who either have a condition such as obesity and diabetes, and we want to study how their metabolism is affected by that, or how they respond to either treatment by drugs or altered nutrition. We can then look at the causes of those conditions, and secondly, work out, together with the scientists, together with the clinicians, ways of actually either treating that condition or preventing it entirely. The calorimeters that are within the Human Metabolism Research Unit are actually only the second set of calorimeters within the UK. Therefore, it is going to be a fantastic facility for industry and for the NHS to avail themselves of. We work very closely with industry, primarily to develop new drugs or new functional foods. We make sure that the work that we do is relevant to the delivery of better nutrition, better diet and better healthcare.
Also, we are very keen to measure the impact of our research. We were awarded from the World Health Organization the Collaborating Center for Research, acknowledging that our research was important in helping them shape policy globally. Considering that we are a very young medical school, we have achieved quite a lot, quite rapidly. Aspirationally, we would like to complete that spectrum of translational research by improving public engagement. And I think we're very well set to achieve that in the next few years.
I'm really excited at the way things are going. We have a very strong team here, addressing very important chronic long-term metabolic diseases like obesity and diabetes, tackling questions which are important for society and for the delivery of excellent healthcare.